The needs of the community out here are similar to the needs of uninsured patients, Medicaid patients, anywhere in the country. Our board received a letter from over 30 community-based organizations, as well as elected officials, asking us to look into the feasibility of starting a community health center in Waukesha. And after several years of looking into that, we decided it was a good thing for us to pursue.
I like to think of the Community Health Center as a holistic entity. The community consists of children, adults, pregnant women, women who just seek normal health, and our community health center, any community health center, will focus on all of them. And so because we have so many different populations within our house, if you will, it's important that the staff then has an understanding of each particular persona.
So what makes the 16th Street Community Health Center, I think, unique is not only our responsiveness to community needs, but we have largely bilingual, bicultural staff. So we're able to immediately respond on that level. I think that's a unique feature.
What we know is that if you provide services in a person's primary language, the compliance is always going to be better.
I've definitely noticed a big difference with the community health care patients that we have, with the community health focus that we have. The patients are more seen in a global aspect. We try to look at every aspect of their health care. And we work as a team. We have a team of educators, and we work together to give the patients the best care possible. And I feel like that's really different in the community health setting.
Pediatric, family practice, women's health. And then on top of that, we have specialties within the clinic, behavioral health, HIV. So we truly meet the needs of the community. You don't have to go to different places to get what you need regarding your health care.
We have staff that have training in behavioral health consultation and an integrative model. And I think that alone is going to be something that's really cutting edge, and we're prepared to not only provide traditional psychotherapy services and treatment, but also responding to the primary care, the integrated model that I was speaking of earlier.
16th Street was one of the earlier organizations that got into taking a look at electronic medical records. With the fact that the patient information is all assembled and stored electronically, we know that that information is not only accessible and available, but there are relationships that we could now make in terms of, like, we can drill down at the patient level and say what's going on specifically with our individual patient. But then we can look at the patients in an aggregate to look at how are we doing with respect to certain group of patients, with respect to certain care concerns.
In this day and age, I think electronic health records are the future for our patients and for our patients' care. Everything's pretty much connected now. And the fact that we can use products that connect directly into the patient's medical records, it helps to streamline their care. Their EKGs are a part of their record that we use. Pictures of their optic disc we can keep on their medical record as well. So it just helps to ensure the patient gets the best care possible.
What I appreciate is that it facilitates communication between professions. And so we have 3 buildings. Everyone in all 3 buildings have access to that one patient record at the same time. We have the capability of communicating with other professions. So if we have patients who are being referred to a cardiologist or a specialty, we will have the capacity to be able to communicate with those doctors, and they will have all of the patient information that will empower them to provide our patients with good care.
We provide quality care to our patients, and we do so in a cost-effective way because we don't have some of the overhead and the cost structures that the big hospital system has, in our role as a community health center.